Tamakashvasa. The word Tamaka here is the darkness. So, why this name is given? Because the onset of swasa due to darkness, and the patient is also experiencing the darkness in front of eyes because of the stressful breathing. Okay, let's see about the tamakashvasa in detail. Pratilomam yada vayuh srotamsi pratipathyate ग्रीवां शिरश्च संगृह्य श्लेष्मणां समुदीर्यते च करोति पेनसं तेन वृद्धो गुर्गुरकं तथा अतीव तीव्रवेगं च श्वासं प्राणप्रपीडकं प्रताम्यति स वेगान् दृश्यते सन्निरुध्यते. Pratilomam yada vayu srotamsi prapadyate. Here that because of the pratiloma gati of prana vayu in the pranavaha srotas, siram Grivam shirascha sangruhya slekshmanam samudirya cha. Here, thus pratiloma gati of that pranavayu, it enters into the griva and shiras, where it is filled with the kapha. There will be obstruction to the vata because of the kapha vrita, and produces the symptoms like that of karoti penasam tena vitto gurugurukam tata. It produces the symptoms like that of the penasa, that is presence of mucus in the nasal passage. Gurgurakadvani, it produces the cracking type of sound in the kanta pradesha. Okay. Ativa tivra vegam cha shwasam prana prapedakam. Here it produces the severe dyspnea and stressful, because of the stressful breathing. There will be a severe dyspnea which is produced by the which is experienced by the patient. Shwasam prana prapedakam, it will be severe and it is very dangerous for the person. Okay. Pratamyati sa vegan trushyate sanirudhyate. Pratamyati here is that productive cough with expectoration of the sputum is present. Vegan trushyate sanirudhyate. Here that the patient feels comfortable temporarily at this episode and repeats frequently. We have to explain, or we have to consider that there will be a productive cough with expectoration of the sputum. After the expectoration of the sputum, after spitting up the sputum, the patient feels the temporary pratamyati sa vegan trishyate sanirudhyate. Here there will be productive cough with expectoration of the sputum, and the patient feels comfortable temporarily after the spitting up of sputum, and after some times the episode of the severe dyspnea repeats. Pramoha kasamanascha sagachati muhun. Here pramoha here is mainly there will be a confusion. Okay, because of the tivra vega of shwasa, the person goes into the state of confusion or delirium or dilemma. Okay, next we are having kasamanascha sagachati muhur. There will be onset of this dyspnea with a dyspnea along with the cough. There will be onset of dyspnea and also cough is present with a time gap. Okay. Slekshmanyam muchamane tu brusham bhavati dukkitaha. It produces pain and difficulty while the expectoration of kapha, and also the person tasyaiva cha vimokshante muhurtam labhate sukham. The patient feels satisfied after expectoration of the kapha for some time. Okay. Tata asyot vamsate kantaha. There will be swaradvamsa or swara bheda is there. That is the hoarseness of voice. Okay. Next is kruchrat chaknoti bhashitum. Here there will be difficulty while talking. The patient feels difficulty while talking. Here we have to consider that there will be different suppressing and aggravating factors which are responsible for this tamakashvasa. Na chapi labhate nidram shayanah shwasa piditaha. Okay. Nidram shayanah shwasa piditaha. Parshve tasya avagruhnati shayanasya samiranaha. Asino labhate saukyam ushnam chaiva abhinandati. Okay, the person can't able to sleep properly in the supine position, as the dyspnea has been the episodes of dyspnea is increasing, because there will be a flattening of the diaphragm muscle. It does not give enough space for the lungs to expand, and hence there will be compromised breathing is present. Parshve tasya avagruhnati shayanasya samiranah. Parshve tasya avagruhnati. So they are explaining the same thing here, that because in the supine position, the parshve tasya avagruhnati shayanasya samiranaha, there will be no proper space for expanding of the lungs, so there will be severe compromised breathing is there in case of the person suffering from shwasa. And if the person is in sleeping position, there will be compromised breathing is there, and the person can't able to expand their lungs properly because of the upward of the because of the flattening of the diaphragm muscle. Asino lavate saukyam ushnam chaiva abhinandati. The person who is in, because of that severe distressful breathing, the person sits up in the sitting position. When the person is in sitting position, the person feels comfortable. Okay. Uchritaksho lalatena svidete brusham martiman. Uchritaksho here is the upward movement of the eyes or upper gazing of the eyes. Lalatena svidyata. Lalatena svidyata here is a severe sweating in the lalata pradesha, that is in the forehead region. Brusham maratiman. Aratiman here is mainly there will be a severe body ache or body pain is present. Vishushkasya muhushvaso muhushchaivava dhamyate. Here there will be vishushkasya. Vishushkasya here is mainly there will be dryness of the mouth. Muhushvaso, the person takes the slow breathing, there will be shallow breathing is present. Meda ambushita pragvataihi slekshmalaischa vivartite. So these are the aggravating factors. Those are medha. Medha here is a cloudy days. Ambu in during the rainy season. Shita in the cold climate. Pragvataihi when exposed to the early morning misty wind. Okay. Slekshmalaishta vivardati. The consumption of the kafakara ahara viharas, it will lead to the aggravation of the symptoms of the tamakashvasa. Sayapya tamakashvasa sadhyo va syanavotitaha. So this tamakashvasa is considered to be yapya. If it is of the new version or newly manifested, then it is sadhya. Acharya Charaka has explained the two types of tamakashvasa, that is pratamakashvasa and santamakashvasa. Here, in case of pratamakashvasa and santamakashvasa, let's see. The first line explains about the pratamakashvasa. Jvara mucha paritasya vidyat pratamakam tutam. Here, along with the symptoms of all the tamakashvasa lakshanas, along with that, there is presence of jvara and murcha. The person suffering with the tamakashvasa is having the lakshanas of jvara and murcha along with the samanya lakshana of tamakashvasa is considered as pratamakashvasa. Santamakashvasa here is Udavarta, the person who is suffering from Udavarta Roga, Vrajo, the person who is exposed regularly to the dust, fumes, pollutants, etc. from the mouth and the nose. Ajina, the person who is having the regular ajina. Klinnakaya. Klinnakaya here, different acharyas has given the different explanations. Klinnakaya here is increased tamoguna in the body, is also one of the cause, and also it is a vishtapta ajina in the person. Okay. Next we are having the Kaya Nirodhaja. Kaya Nirodhaja, the word meaning is mainly the person who is doing improper pranayama. The person who is not doing proper kumbhaka, puraka and rechaka in a sequence wise and with a proper time gap. So because of the improper practice of pranayama, it is also one of the cause for aggravation of the shwasa, that is called as Santamaka Shwasa. So next we are having Shitaishchamshu Prashamyati. The symptoms of this are subsided by the use of Shitala upacharas. Okay. Majastastama Sivasya Vidyat Santamakam Tuyat. Because of the manifestation of this roga, the person feels like entering into the darker side or darker region or entering into darkness is considered as the Santamaka Shwasa. So rather than saying they are the stages of this, first the Pratamaka Shwasa is going to manifest. After Pratamaka Shwasa, the person enters into the Santamaka Shwasa. Chikitsa of this tamakashvasa. So Acharya Charaka has explained the general line of treatment in the patients of the Hika and Shvasa. Okay, the person who is suffering from the Hika and Shvasa disease, the first and foremost, the Atyayika Chikitsa is done here. Hika Shvasartitam Snigdhairado Svedhairupacharet Aktam Lamanathailena Nadi Prastara Sankaraihi. So they are explaining to give the snehana by use of any of the vatara dravyas or any of the plain thaila like tila thaila can be taken, and it should be mixed with the saindava lamana, and general massage or abhyanga should be done at the ura pradesha, followed by the svedana is done either by the nadi prastara sankara. By the usage of vatara or snigdha dravyas are used for the svedanartha. Okay, tairasya gratitah slekshma srotah Swa-abhi-viliyate. They are explaining that the by the snehana and svedana, the srotasis which is obstructed by the kapha, so it gets liquefied. The kapha which is obstructing the srotasis in the uraha pradesha or in the chest region, it gets liquefied by the snehana and the svedana, and the srotasis are kani mardavam mayanti tato vatanulomata. So Khani here are the srotases. There will be loosening of the srotases. The liquefied kapha comes out from the chest area which is adhered inside, and anulomana of the vayu is going to takes place. So by removal of this obstructed kapha, there will be easy or the this is allowing the easy movement of vata inside. Okay. Next, यथा यथाद्रिकुञ्जेष्वकाशुंस्तप्तं विश्यन्दते हिमं श्लेक्ष्मातप्तः स्थिरो देहे स्वेदैर्विश्यन्दते तथा. They have given a simile where the barf or the icebergs we can get, the icebergs where they are stronger and adhered in the oceans in colder climates. So after the exposure to the intense sunlight, they get liquefied. In the same way, the kapha which is adhered and which is in the form of gratita or granthi which is adhered there, it will get liquefied after the snehana and svedana. Okay, and makes the easy passage for the flow of vata. So the special line of management has been explained for the tamakashvasa here is kasine chardanam datyat swarabhange cha buddhiman vatarslekshma harairyuktam tamaketu virechanam. Okay, here they have explained that the person with the shvasa roga, if he is suffering from this swarabheda, then buddhiman vaidya has to go for vamana prayoga, and if the person is suffering with the tamakashvasa, specifically the person is having the problem of tamakashvasa, then they have to go for the virechana, which is both vata and kaphahara. So vatakaphara dravyas or the drugs are taken and they have to go for the virechana. So the best things to consider in case of vatakaphara are mainly the avaleha forms. So one can go for the trivrit avaleha or aragvada avaleha. Aragvada phala majja avaleha is available, so they can go for that for the virechanartha in the tamaka shwasa patient. And you have to remember in their mind about their the rogi bala and roga bala. Okay, rogi and roga bala has to be considered before going to give the virechana. उदीरते वृषतरं मार्गारोधात् वहज्वलं तथा यथा तथा अनिलस्तस्य मार्गं नित्यं विशोधयेत्. By giving the simile, they have explained that the for the Vayu Marga, to relieve the obstruction for the Vayu Marga, Nitya Virechana or Nitya Shodhana should be done. They have explained it to give the Nitya Shodhana to relieve the or to clear the passage for the Vata. Some of the drugs which are used in case of this are the first and foremost here is the Agastya Hritiki Avaleha, Vasa Avaleha can be given, Vasa Karishta can be given, and also Swasa Kutara Rasa is given, Lagu Shuta Shekara Mishrana can be given.